everyone, my name is Eve Harrison and I'm a junior board member at Miles4Hips, and today I have physiotherapist Nathalie Belanger with me, and we're going to ask a few questions about her role on the hip dysplasia patient care team. First, I'm going to introduce myself. I'm from a small town in Northern Ontario, so when I started having a lot of hip pain as a teenager, there were no real specialists nearby. So Nathalie was a very helpful consultant for my local physiotherapist as I rehabbed from both my PAO surgeries. Nathalie works in Ottawa, Ontario, which is the capital of Canada. So first, Nathalie, I'll ask you to introduce yourself to our audience.
Yes, hi, my name's Nathalie, and I've been a physiotherapist since 1998. I did my undergrad degree at the University of Ottawa, Bachelor of Science in Human Kinetics, and then I went on to the University of Toronto, where I graduated with the Bachelor of Science in Physiotherapy. Since then, I've been working at the Sports Medicine Clinic at Carleton University, coming on 26 years now.
Wow, awesome. What led you to physiotherapy as a career?
With an undergrad in human kinetics, I figured the pathway was either going to go towards education or physiotherapy. And I had spent 3 years working with the football team at the University of Ottawa, and decided that I like treating athletic injuries. And so
Yeah,
that's the pathway I chose.
yeah, that's awesome. Um, what is your role for hip dysplasia patients in particular?
Well, as a physiotherapist, we're seeing more and more patients coming along with these types of surgeries, whether diagnosing and then treating hip dysplasia, labral tears,
Mhm.
um, osteoarthritis. And my role is to provide education first of all, and then the proper rehab and a good functional recovery to activity.
Yeah, for sure. Um, Actually, I was gonna talk about this. When I got my hip dysplasia diagnosis, my doctor said that it was a once in a career diagnosis for him, and he's never seen this before, and he's never going to see it again. And I think that actually hip dysplasia goes pretty underdiagnosed, and I was wondering what your thoughts are on this, and if you think it really is a once in a career diagnosis.
Well, it's not once in my career, that's for sure, but I
Mhm.
see a lot of these hips. But I would agree that at least in physio school, which was many many years ago, it seemed like we just kind of skimmed over that. There was maybe not as much research, not as much information, and admittedly, in my first probably 10 years of my career, these patients would come in with this type of hip pain, groin pain, and we weren't really sure what to
Yeah.
do. The imaging has gotten better, the education has gotten better. So based on that, I went on and took several hip courses and hip symposiums, just to further educate myself. And all of a sudden, it just became more and more clear why these people were suffering, and what was actually going on inside, intra-articularly inside the hip,
Yeah.
that would suffer.
Yeah, it's so important to keep educating ourselves throughout our careers, and I think like especially for hip dysplasia, like it's not very many medical professionals are super educated on it, and it's so hard to get a diagnosis. For me, it took several doctors and surgeons to ultimately get my hip dysplasia diagnosis. So I think it's so important that um that you've gone to all these symposiums and gotten educated on all this.
And
Um,
that's entirely uncommon. A lot of people that come and see me have seen other specialists, or other therapists, and things may or may not have been helping, but ultimately, the diagnosis wasn't put in place at that time.
mhm, mhm. Do you help at all in the diagnosis process, or are you more on the rehab side of surgery?
So definitely rehabilitation is what we do. But if I have a young athlete or a person that comes along and I'm suspecting something like hip dysplasia, labral tear, arthritis, any of those kind of things that I think would require imaging, basically anything that's intra-articular,
Yeah.
um, then I will refer on to one of our sports medicine doctors so that they get the right imaging put in place, or even back to the family doctor, whatever the case would be. But the important thing is to have the right imaging put in place, and then from there we'll start the rehab.
Yeah. For sure. I know you said that you didn't think that there was as much education in hip dysplasia in physio school when you were in physio school, but do you think that that's getting any better or
Well, likely I think it is because if we think back, the first PAO surgery, if I'm not mistaken, was only in 1984
Mhm.
in Switzerland. So, that's not that long ago. And
Yeah.
then I meant to look up before I talked to you, but in Canada, the United States, I think it came after that. So, um,
Hmm.
the education and the surgery is what we consider relatively new. And so, I think in school we just perhaps didn't have enough knowledge. Not that we
Yeah,
didn't learn about the hip, but
yeah,
to these types of surgeries for sure.
for sure. Do you think that family doctors need to be more educated on hip dysplasia so that more early diagnosis can happen?
Well, I think that's helpful is to understand the signs and symptoms because if hip dysplasia gets missed, then it predisposes a person to earlier arthritic changes. So we don't want that. But yes, the sort of symptoms that these people can feel. I think it's important for family doctors to know that for sure.
Hmm. How did you get into hip physio specifically? How did your interest get piqued in that area?
I think specifically, I also had a hip injury, but also too, I think that there was maybe some frustration on my part that I was seeing a lot of hips, but weren't necessarily getting better. So, we just had to, and as I was taking my courses, I took a very good hip course that sort of, light bulb went off. And I thought, oh, okay, we need to look at these hips a little bit differently. They're maybe not just coming in with, a groin strain or hip flexor
Hmm.
tendinopathy. They're maybe coming in with something a little bit more serious that requires the imaging because they're not getting better.
Yeah.
And so, just based on that, and starting to take some courses, it just kind of went from there. And I have a good relationship with the hip orthopedic surgeon, specifically one at CHIO that we work very closely together. So from there, I just built a network and started to see more and more hip patients.
Yeah, that's a really amazing story. Do you have any advice for someone that's looking for a diagnosis or struggling to find their diagnosis of hip dysplasia with their medical professionals?
The biggest thing is to advocate. So I always feel that, and I often ask the patient, um, patients often know that something is wrong. So if they
Mhm.
feel like it's wrong, then they need to advocate. And sometimes you need to get a few different opinions. Not everybody sees things the same way. Not everybody sees things from the same lens.
Mhm.
So, sometimes it's just putting the pieces of the puzzle together and finally coming up with a diagnosis. It doesn't often, it doesn't always happen on the first attempt.
Yeah.
Sometimes try different things. And so, and some people with hip dysplasia do very well with just a rehab program, and they don't necessarily need to go on with, the big surgeries like the PAO.
Yeah. I think that point about self-advocacy is really important and just being persistent and talking to as many specialists as you can and making as many appointments as you can until you get the real answer that you need.
Hmm.
Hmm.
Hmm. For sure.
Um, and then after a big surgery like a PAO, what advice do you have for people going into it and recovering from their surgery?
Well, the PAO surgery, as you know, is a long one. So, but the surgeons that we work with, every surgeon's got a slightly different protocol, and so we work within the limits of their protocol. So,
Mm.
it's taking it slow at the beginning, and then and following the protocol. But then we really go based on a patient's goals. So, for example, if somebody's a high level athlete or a long distance runner, then we're gonna tailor the end stage rehab to what they want to do, what they want to get back to. If
Mhm.
someone's more sedentary, then their rehab's going to look a little bit different as well. So it's really, following the rehab protocol and then tailoring near the end to suit the needs of the patient.
Yeah, I think that's a really good point. It's really not a one size fits all thing, and different surgeries and different people have all different experiences, and just making sure everyone has the resources they need for their particular experience is important.
And that's absolutely it. Not everybody fits the protocol to a T. Sometimes we do have to make some adjustments as
Mhm.
we go, and that's okay too.
Yeah, for sure. And then lastly, how do you encourage patients to be active members on their care team?
In what way?
Like, I guess mostly the advocacy piece, and then like self-advocacy, and just
Well,
understanding their diagnosis and being active in their care.
that's it. I always give information to my patients, whether it's websites that they can go to and look and dig a little further so that they really understand. Because when someone comes and sees me, I'll give them as much education as possible, but sometimes it's very overwhelming.
Yeah.
Um, and especially if I'm suspecting something like a hip dysplasia, or and the proper imaging hasn't been put in place, sometimes that kind of information is overwhelming. So then directing them to other resources so that they can pursue further information is, I find, often helpful. And we often involve other members of the team, massage therapy, other things. So looking at other helpful therapies can help it as well. I don't pretend that only physiotherapy is going to help somebody with hip pain. Sometimes we do
Yeah.
other as well. So
Yeah, I totally understand that going through all those different channels is important. I myself had massage therapy, I had physio, and I saw so many different specialists, and I think going at it from all those different routes is important to find what will work for you and what your solution will be.
that's right.
hmm Is there anything else that you wanted to discuss today or bring attention to our Miles for
Well,
Hips audience?
I think that ultimately, I mean, having treated these injuries for several years, and many of them, ultimately these patients do really, really well, and the outcomes are we see very few complications, and mostly excellent outcomes. And so I think that even though it's a big surgery, it's a scary surgery, I understand that the outcomes are very, very good, but it does take a lot of work and it takes a lot of patience, because
Yeah.
it's not that gets better after 1 or 2 months. It does take some time, but
hmm
we've seen great success stories with these PAO specifically, specific surgeries, and that's nice to see, because it's nice to see somebody, especially in the younger population, get their life back essentially.
Yeah. Awesome. Well, thank you so much for joining us today. I'm sure that this interview was very helpful for a lot of people, so thank you so much.
Thank you very much for having me.